Right. I apologize at home for the view, but we are live to discuss The Witch. Where would you like to start? Anyone?
I guess we're kind of sort of trying to figure out what is the psychological tie-in for The Witch, and I think my guess is going to be that it's kind of substance use related. And my theory on that is the fact that she has a lot of risk factors that would, like Thomason specifically, who seems to be the main character of this, she has a lot of risk factors that seem like would lead her to substance use, and then also she's kind of brought there by the goat, like Satan, quote unquote, and the birds kind of lead her to there, and then you kind of see her in the circle with the other witches, quote unquote, and she says that she feels like this out-of-body experience, which I think people have said they can experience depending on what substance is. And then also the fact that she's leaving her family and the family is kind of fallen apart. I think you kind of see in families who have been affected by someone who has had a substance use disorder. So that's kind of my theory on what the psychological tie-in for this movie is.
Interesting. All right. So you gave us a lot of information here, most of which I think I was able to take down. Okay. Family falls apart.
Just going off of that, I read online. The director said the corn that they're growing, there's a scene where the corn is kind of moldy, and he said that's ergo or ergot, and that's LSD essentially. So basically the idea is that the family was basically hallucinating and delusions. All that was based on the fact that they were essentially consuming LSD the entire time.
You need to send me that link.
I did see something similar to that. So that's probably the director's intent. Mm-hmm. I was just looking at facts on IMDb, and it says that apparently ergot
is for wheat.
It doesn't grow on corn. But I think that probably the director thought that it did.
It says it's uncommon, but I think it can.
Oh, really?
It's more
okay.
common on rye.
It's literally IMDb, so it could just be wrong. That it says that, but.
Okay.
It's just cereal grasses.
Again, we have a lot going on here. All right.
And then, that's one substance, but also, I think, in the scene we find out Samuel, the youngest son, is taken away, and it's kind of gross, but they use the witches use the baby to make, some ointment, flying ointment to fly, and that might just be another, substance. So, at the end of the movie, you see, the witches are flying, literally in the air flying. That just might mean they're, essentially hallucinating from this ointment.
And also I think part of it, the kid being taken away is something that you see happen when families have when you have parents who have substance use disorders because they can no longer take care of the kid. And so I think that might also tie into that because the kid is taken away literally.
Okay. All right. Let's pause for a second. Anybody remember the goat's name? Bill?
Black Phillip.
It's Philip. All right.
Black Phillip, yeah.
His real name is Charlie.
The real goat.
The goat, yeah.
He's apparently very competitive.
Yeah,
I read that.
I guess that's
Charlie starring as Black Phillip.
Charlie.
Yeah.
Got you.
So I guess the goat really was the devil.
Yeah, he didn't like being
Yeah.
on set, which is kind of funny.
Oh, and also I think it's also interesting, the juxtaposition of the quote unquote freedom of the potential substance use and and what we kind of discussed in that meaning of it with the puritanical society with the strict rules and things. And I think that's also can be considered even allegory for how the U.S. treats or historically has treated substance use disorder. Mm-hmm. And also we oftentimes talk about how the U.S.'s puritanical views on things are still influencing the way we treat and view things today. And I think literally using Puritans for the sake of this movie, I think kind of ties into all of that as well.
Mm-hmm. Mm-hmm. All right. So trying to tie Thomason, say that sound quickly, Thomason into some historical perspective, links quite directly back to the Salem witch trials, and there is a conspiracy theory that these Salem witch trials were a product of ergot poisoning. That's a published article. Unfortunately, it doesn't really hold up all that well, at least from people that I've discussed it with, but Many people believe that what happened in the late 1800s with the Salem witch trials was influenced by an LSD-like effect, starting with two young girls of the Paris family, a daughter and a cousin, and then that quote-unquote mass hysteria spreading from there. So the fact that it seems like the writer-director may be of that group, of that school of thought, and made an attempt to recreate this now with corn. We'd have to, I'm not from the Midwest. I couldn't tell you whether it's wheat versus corn. I know that the theory around the Salem witch trials was wheat. I know that for a fact. Whether ergot grows wildly on corn, I don't know.
And I was going to say the other thing, like, tying into substance could be that, like, witches were, I guess, like, I can't remember if people thought this or they actually used, like, different herbs that were, like, hallucinogens and things like that. So.
I saw an interview with the director. So he is from the New England area, and that's what began his interest in witches and whatnot. Certainly inspired by the Salem Witch Project, or not the Salem Witch, the Salem Witch trials. And he actually said that back then it was interesting because they didn't have mental health. So anything that was hallucination or whatnot was just attributed to being a witch, not to components of mental health. So that actually, his response in that interview would steer me actually away from substance use and more into mental health or some kind of mental illness that would be causing, because I think he would have, in that setting, would have said, instead of attributing these witch tendencies towards substance, they would just have no other explanation and just say this is a witch thing. Instead, he chose to say, any mental health disorders will not be attributed to being a witch, not actually having treatment and diagnosing and whatnot. So I think maybe for him, he had an underlying mental health disorder in there that he was going for. Right.
Yeah, during the Salem witch trials, they actually did consult with a parishioner, Dr. Griggs, who stated that when you looked at Abigail and blanking on her name, the two young girls, 9 and 11, that there was no underlying medical condition that can explain their behavior. And of course, we take that today verbatim out of the DSM to say then it might be induced by a mental disorder. But back in the 1800s, the mental disorder was demonic possession. Right? And that's why if an individual sleeps with the devil, has coitus with the devil, they're considered to be a witch. Right? Which is why the witch trial started. Right? It's a way to persecute the mentally ill. Right? But Griggs was the physician that rendered that medical opinion, that there was no underlying medical cause that can explain these two young girls' symptoms.
I also want to say that I don't disagree with that as well, and I want to say, I think you can have both, because mental illness does oftentimes lead people to substance use, and substance use can also worsen mental health, and it's kind of a cycle. So I definitely think there probably is a component of mental illness, we see with the mother, how she could potentially have that postpartum psychosis, as we mentioned earlier. And then we also the kids are probably traumatized. They're also a very isolated family from the rest of society, and so that could lead to poor outcomes in terms of lack of support system, depression, and those types of things. So I think you're getting and also if the mother has postpartum psychosis, which makes her likely to develop bipolar, that also means that as a family they have history of mental illness. The father clearly had some sort of anger thing, and he has his own issues. So overall, the kids are also very likely to develop mental illness, just based off of the societal things that are going on there, and the fact that they're so isolated from everyone else. But I also think that those things actually make them very likely to develop a substance use disorder. And I think what we see in the end is Thomason developing a substance use disorder to kind of get away from everything that's going on and everything that's happened. And I think the family ends up falling apart due to that. But I also do think that they have a lot of underlying mental illness prior to all of these things happening.
One of the things that you had mentioned before kind of ties in directly to this too, and that is the puritanical. Thank you, puritanical culture. In this family in particular, we see them, they're ousted. They're alone. And they are on the frontier, and they are just like a minute away from total annihilation, and that's what they have to deal with, and that's what the early settlements have to deal with. And that level of stress can result in direct psychosis, right? That's the phenomenon in psychiatry we call stress-induced psychosis, even without any predisposition, and they probably have predisposition anyway. But hypothetically, even without predisposition, that level of stress can still induce psychosis. Then you add, like you said, that genetic predisposition perhaps, as well as any use of substance to self-medicate, or how you want to metaphorically take it. And you could see what develops here, right? All right, so hallucinogens, right? Whether this was a true ergot poisoning or not, who knows? At least it opens the door for a discussion of substance use in general and the use of hallucinogens in particular. There are 3 subclasses of hallucinogens. What are they? Number 1, psychedelics. Okay. Number 2, dissociatives. And then finally, deliriants. Deliriants first, I think, for us anyway, I think the most straightforward. We all know now and all have, for better or for worse, become very familiar with delirium. So think anticholinergic, antihistaminic as the primary mechanism to result in the mechanism of the deliriums, right? These drugs can be abused. We actually had a grand rounds this past Thursday, just yesterday, on the abuse of deliriants, anticholinergics and antihistaminics, right? Dissociatives. Give me an example of a dissociative. Ketamine, right? I don't think that's what's going on here. Right? Now, interestingly, as far as the actual signs and symptoms go, this might be at the top of our list, in terms of that out-of-body experience. But ketamine and ketamine-like drugs, substances, including PCP. How do you identify PCP?
Nystagmus, aggression, and all the question stems. It's like combative with hospital staff or ED staff.
Sympathetic stimulation,
Nystagmus, right. When you look at any of these drugs, there will always be behavioral and somatic components. And they're listed separately in the DSM. Usually the behavioral manifestations are in the little paragraph prior to the list, and then the list is of the physiologic signs and symptoms of the drugs intoxication syndrome. The behavioral symptoms are just that, right? Combative. Who here has seen The Terminator? Right? Anybody here remember the police station scene?
Yeah.
Right? And that's the one that's cued in by the tagline, I'll be back. Right?
Yeah.
So the sergeant tells him to get lost. The desk sergeant tells him to get lost. Arnold tells him where to go. He leaves. And then the scene shifts to Reese and Sarah, who found the detectives and are explaining what's going on. They're explaining the plot up to this point. Right? Sounds a little outlandish. I'm being persecuted by a cyborg from the future. Right? They quickly identify that Reese really appears to be impaired, and that Sarah is a product of that, right? That she's someone who might be suggestible and has incorporated Reese's delusion. What do the detectives diagnose Sarah as having? Although it's not in the script. What I just described to you.
That's that French word.
Fully
Something.
Excellent.
Was that it?
Yeah, was it? Fully ado.
Yeah, I do.
Yeah, fully ado. Shared psychotic disorder. What's the next best step?
Separating the two.
What do they do in the movie?
Don't they separate them?
That's exactly what they do. Right? Now, Reese goes with the psychologist because they identify his being the index case. And Sarah stays with 2 other detectives. Quick shot. Reese is climbing the walls, right? Which we would know is the likely occurrence. Sarah softens when she's alone, and she gains significant insight I know it sounds crazy, but ... And she turns to the detective and says, I saw him put his fist right through a windshield. Next line from the detective.
Was he on PCP?
Yeah, it's right in the script, right? And then as soon as he says that, seconds later, Arnold drives through the wall of that precinct and just kills everybody, right? Assaultive behavior, belligerent behavior, right? Aggressive behavior. The actual psychological manifestations of the drug just out of the detective's mouth, right? So watch that scene, not right now. Go to YouTube, check it out. You'll never forget what the behavioral characteristics of acute PCP intoxication looks like. If you want to remember the physiologic manifestations of PCP, you look at the DSM criteria, you have to rearrange because the APA didn't think this through, but it actually spells out the word terminator.
Oh.
Right, so can't miss it. The R stands for rotary nystagmus. Right. I will post that slide for you guys later, if I remember tonight. So it'll be up before your shelf exam, right? So that's PCP, right? And to a large extent, ketamine as well. Right. Questions about deliriums or dissociatives?
Wait, can't we have like what is it, what are they called? The other class that we haven't talked about yet? Can't those also have some dissociative effects? For example, if somebody takes too much marijuana, they'll start having like kind of out of body or like have some sort of dissociation or realization.
Yeah. There's nothing specific to these subclasses that would preclude them as incorporating some signs and symptoms from the other. Yeah.
Okay.
Yeah. Psychedelics.
Yeah.
Right. Give me an example.
LSD.
LSD. So that's the biggie, right? Shrooms, psilocybin, LSD. Behavioral characteristics.
Does it get flashbacks?
They could. Any of them could, really. But yeah, LSD definitely can.
Like hallucination.
The visual ones.
Mm-hmm. The easiest thing to remember here, this is the psychiatrist's steroid, prednisone. It hits everything, right? Anxiety, depression, mania, psychosis. It's the big four, all right? So when you see a vignette on your shelf exam and it looks like they have bipolar mixed, that is manic and depression, psychosis and anxiety, think LSD. LSD's physiologic primarily looks like panic plus that distortion of time and space. That combination is a real good bet to be LSD as your single best answer. Give me one manifestation of this distortion between space and time. Clinically, what might or how might the patient present as a result of what?
Maybe their speech pattern is either slow or fast, indicating that they feel like they're talking like at a normal pace, but they're talking much faster or slower because of their time distortion.
That could happen, yeah. Another one?
Not eating or showing up places at weird times if their time is off.
Could be. Another one?
So things are like moving at like different speeds. So
And what might they do as a result?
Walk into the street.
Very close. You're thinking horizontally.
Car accidents. Jump off stuff.
Yeah. Right, which is a very common, well, too common of an occurrence, I should say. It's not very common. Too common of an occurrence. When you have that level of really, it's space distortion. Individuals may look at a 7-story drop as nothing, given their experience that they just internally had. Unfortunately, as a product of acute LSD intoxication, individuals have stepped off of buildings, right? No necessarily like overt suicide attempts per se.
Without suicidal intent.
Right.
Just like, oh, it looks so cool. Look at all those little people. I want to go and give them a hug. And then
Boom. Movie.
Wait, movie? What?
In that movie, Cooper.
jumper.
Close. He's a jumper. He actually is part of a jump program specifically.
Were the rob banks or no?
Are they like paratroopers?
No, but
Like
that actually
Inception.
happened with World War II, our World War II
Inception,
vets.
but they don't jump.
Yeah.
Star Wars?
Like,
Nope.
Well, yeah, is it Inception? Because they're
Nope.
like.
Was that? What color does LSD light up as under
wait,
black light? Don't say it. I told you already.
Yeah,
You can't. You can't say it. You, huh?
Is it purple?
Nope.
Yellow.
Blue.
Is it Zootopia?
Blue.
No.
It's like blue.
No, I know, and I'm not gonna say it.
Oh.
Who's presented with the blue versus the red pill?
Oh,
Matrix.
Yeah.
Yeah.
So that's a major.
I forgot.
No?
Never seen.
Oh boy. No,
I still like
I give you permission to leave your clerkship right now if you promise to watch The Matrix before 4 p.m. today. Yeah, The Matrix is a remake of Alice in Wonderland, which
Wait,
is
it is?
Alice. Yes, yeah.
Oh, I didn't know that.
Yeah.
I mean, I also haven't watched it.
All right, so let's deep dive this just a little bit for just to make sure all of us are caught up to speed on the same topic.
Alice in Wonderland has got another good one with all the students.
Oh yeah. No, Allison, I don't think there's any doubt that
Lack
Alice.
of hallucinations and that.
Yeah.
So I've not seen Alice in Wonderland either, so you're gonna
Oh,
have
wow.
Well, you've read it though, right? You heard of it? No, you Wikipedia'd it? No.
I've heard of it.
Heard of it?
But not
Not
really.
even Disney. Not even, wow.
How when Neo begins his journey and finds Morpheus, what initiates that?
He's a hacker and he's told to find the white rabbit.
Yeah.
It's Alice in Wonderland
Yeah.
time.
But
Right?
also, like, it's a clear reference to Greek mythology because Morpheus of the underworld.
Yeah.
Yeah.
Yeah, that from that side, we could definitely deep dive not only the Matrix but even Morpheus's character and what's going on in his head. But we won't. We just don't have the time to do that. Back to the witch.
I thought it was about Christoph Jakob.
The witch, or
The witch, yeah.
how so?
I figured that, as I was watching, I was like, this actually could be like Christoph Jakob. Very rapid progression, right? If they're eating these animals that have prion disease, it goes one by one, kind of quickly. So that's what I was hoping that you would actually get at today.
Well, how did you know I wouldn't? We're not, we just started.
I don't know, it sounds like it. More likely now that I'm hearing it, sounds like substance use.
Once as a clinician you rule out the direct physiologic effect of a substance, you then as a psychiatrist have to deep dive or consider medical conditions.
Mm-hmm.
So maybe we just didn't get there quite yet. Any questions before we leave the topic of these three subclasses of hallucinogens? No, we're good. All right. By the way, another comment to Black Phillip. His role looks like it does become more prominent towards as the film progresses, and therefore in some way looks like he leads Thomason through whatever it is that she's experiencing. Who's Captain Jack? And how might Black Phillip be a recreation of Captain Jack?
Isn't that slang for heroin?
Yeah, so it is slang for, I believe, opioids. But in another context, it's also a general allusion to a fictional character that takes you on a trip.
Literally like Captain Jack Sparrow, like.
Well, that does allow. It definitely allows
Well,
for a
just
different
because you said-
interpretation of the Disney film.
So what do you mean takes you on a trip?
Yeah,
Huh?
yeah,
Like the pun? Okay.
yeah.
No one was laughing. Sorry. I love fun.
Yeah. So again, Black Phillip may actually be some kind of a reference to Captain Jack, this fictional character that individuals will have accompany them on whatever out-of-body experience, whether drug-induced. Well, it's drug-induced.
And kind of towards that point too, when he personifies or becomes like anthropomorphized, he kind of dressed like a pirate, just a little bit.
We really wanted to get that reference to Disney, huh? Any other ideas on how this film might allow for teaching of substance use?
Also, I think part of it, I think, is probably like maybe referencing how like drugs are shipped from overseas when they come to the U.S. for the most part. Especially since currently with the drug trade, while we have gotten a lot of drugs from Mexico, a lot of them are now coming from, or synthetic from China. And so maybe like the like the Captain Jack coming on a boat, or like as a pirate coming on a boat might kind of like sort of tie into
You
that.
guys really want this Disney reference, huh?
I do, but also I think it ties well into that just because it's showing that it's coming in from somewhere else, and like being brought to that community. I also think like the isolation of the community and sort of how it's rural, and the fact that like Captain Jack is another way to, or not, is like another way to call it opioids, or yeah. I think that also ties in pretty well into like that substance use message because, what was I thinking? Sorry, because I think a lot of what we've seen is like sort of in the Midwest, which is more isolated from the coastal areas, and I think that kind of plays a part in like why the addiction spreads so bad in the family and in that community, as we see with like the circle of witches. Also, oftentimes with like substance use, it's not usually like you don't just like, you know, decide one day, hey, I'm going to use this. Usually like somebody will like, you'll have a friend or there'll be like something going on. And I think like having the witches circle and having that sort of like group of peers who kind of bring Thomason into that sort of also like speaks to that aspect. So I think those are all the points. There's probably more that I like can think about, but
It is important when someone presents to you, and this is outside the context of Thomason per se, somebody presents to you with issues pertaining to substance use. As we had discussed before, always think along the 3 Ps. What predisposes, what precipitated the use, and now what's perpetuating it, right? And then with each of those conversations, 3 separate formulations, all 3 have to be, should be biopsychosocial.
and I think we've actually hit on all 3 of those too in this discussion as well. Look pretty cleanly.
I do have like other theories I want to talk about that's not substance related.
That's
I don't know if that's like time to get into that.
Sure, what?
Yeah.
Okay, so I thought of like postpartum depression / psychosis for the mom. Like if you take away the fact that like the baby gets stolen, if you kind of use that as like a symbolic thing and the baby's still there, then like, you know, she's super depressed, she's like has trouble sleeping, she sort of like turns against her other kids, and then that scene where she's like thinks that she's breastfeeding is another like big part of it too. And so that was one that I thought of when she was like just like the role of the mom and how she like, you know,
To support postpartum psychosis as a diagnosis in The Witch, looking at this character, what would you have added to the script to make it more evidence-based?
what like maybe thoughts of harmony maybe or something.
That's
Or
quite
doing-
possible, yeah.
Doing reckless behavior.
Why? Yeah, why?
The inability to care for the baby.
Well, yeah, that would be part of it. I want to know more about quote-unquote reckless behavior. When would you see the reckless behavior?
In the first 4 weeks, before the baby disappears.
No, I thought you were going to say. Yeah, why?
Like, I don't know this.
Yeah.
Predisposing psychiatric disorders.
Which one? That defined through reckless behavior.
Bipolar.
Yeah. Yeah. Postpartum psychosis is likely the results or the unmasking of an occult bipolar illness brought upon by the trauma of childbirth, which is why the American Psychiatric Association still terms this condition postpartum psychosis, while they did change the terminology for depression to peripartum depression, because of the observation that about 50% of depressive symptoms occur during pregnancy, whereas postpartum psychosis still appears to be predominantly, or have its onset predominantly postpartum. So a history, somehow, flashbacks or whatever, bipolar illness in the mother would have been strongly suggestive and supportive of postpartum psychosis. What differentiates the postpartum blues to peripartum depression?
Blues resolve after 2 weeks, and depression can last. It's like up to 4 to 6.
What's the other?
Postpartum blues doesn't meet all the psychiatric criteria.
Correct. right? And it's not clinically significant, right? Depression always is, including peripartum depression. All right. What else about mom? Anything?
Not about the mom, but I do have it about Thomason. There's like one line in the movie that she says. So like, well, one of the things is that I think in pretty much every scene where something goes wrong, she's like passed out. So like or at least like something happens or something like that. Like she's just in some state where she's not looking or something like that. So like in the first one with the baby, like, you know, she's not really looking and whatever. I guess you could say symbolically when she closes her eyes, it's like maybe there's some time gap in between that we didn't see. And then the other part was when they're in the woods, on the horse, and she like falls off the horse. It's like everything happened when she was passed out. So I feel like that was kind of interesting. And then also that she, when she's like talking with Mercy, like her little sister, trying to scare her, she says, "I'm that very witch. When I sleep, my spirit slips away from my body and dances naked with the devil." So when I heard that, I was like, oh, her spirit slips away from her body? That sounds like dissociating. Like for an out-of-body experience is like, you know what I mean? Like very much like dissociating.
So let's talk about that a little bit. We talked about depersonalization, derealization disorder earlier today. Individuals with this condition, by definition, really don't experience any gaps in memory. If individuals, as a product of their dissociating, experience any gaps in memory, what is the most likely diagnosis?
Dissociative identity. No.
Well, yes, but what else is in the differential? I heard it.
Dissociative amnesia.
Yeah, there's your two, right? So we're going to go with dissociative amnesia first, although we're going to have to ask a question here to get to another part of the differential. With dissociative amnesia, defined through the gaps in memory, an individual may or may not have some seemingly purposeful move away from their work or their home. If they do, what is that called?
Fugue.
Fugue, right? Right. So
And
dissociative amnesia may be with or without fugue.
But also, I think that can, I know I'm like going back to substance use thing, but like the fact that she says like dancing with the devil, which is like not from like a scientific or any sort of perspective, but that is the name of like Demi Lovato's album that she made after she like, you know, had that overdose. So I think like that ties into that pretty cleanly.
I'll have to trust you on that one.
Okay. It's a good album anyway. But
I'll have to trust you on that one too.
Anyway, so like it ties into that, and also like I think people do often have dissociative symptoms when they have like heroin, when there is heroin use, and also she could have had those gaps in memory because of like the substance use.
And we would only consider depersonalization, derealization, as well as dissociative amnesia, either with or without fugue, only after we have definitively ruled out the direct and physiologic effects of a substance. We always have to start there.
Yeah.
And we're only here discussing the mental disorder, intuitively having ruled that out. Right?
And plus, like, when she's in the barn, she, like, that's another, I mean, it doesn't show her necessarily unconscious, but, like, you see the aftermath of it when the dad wakes up and, like, she has blood on her hands. So I just feel like all the different scenes in it where she's, like, somehow passed out or she's confused or, like, she literally has blood on her hands, like, I feel like could be like, oh, maybe she was a witch the whole time and they weren't wrong because, like, well, not, or just that she was dissociating or something was happening.
And what was her quote? What did she say to her?
So she says, I am that very witch. When I sleep, my spirit slips away from my body and dances naked with the devil. That's how I signed his book. But, like, what was I going to say? Even though it seems like it seems like she later says, like, oh, I was joking, but it was, like, so serious the way that she was trying to scare her sister, and I feel like there was truth to it.
So the idea of my spirit slipping away from my body, metaphor for fugue, a fugue state?
That's how I felt about it.
What other movie? Where a child, every time he falls asleep, has his spirit slip away from his body.
Is that Peter Pan?
Nightmare on Elm Street.
I don't think it's on Elm Street. It might be Peter Pan, which, by the way, is
Is this the first movie thing I've gotten right?
Well, I'm going to give it to you. I'm going to give you the point. I like it. Yeah. But unfortunately, if Peter Pan, we can't say that the single best diagnosis is dissociative amnesia with fugue because it's likely substance induced. What substance is Peter Pan really about?
Fairy dust?
Yes.
Angels, PCP.
Which we can see.
Right, could be, right? So,
I don't know what fairy dust is in like the
well,
real world.
pixie dust is an actual combination of PCP and LSD. And PCP has a street slang of Peter Pan.
Oh, PCP.
Just so that's not bad. That is not bad.
Friendly in Peter Pan to be on.
No, no, he's not. Not.
Captain Hook.
No, no. Peter Pan in the originals
pretty angry,
is
like,
not
he's
friendly.
No.
The Disney version may certainly
And
lighten it
neither
up.
is Tinkerbell.
Not at all.
She can be very,
Very.
very sassy.
Enough on Tink. Let's get back to the other witch. All right. So fugue state, at least metaphorically, right? This seemingly purposeful travel away from one's home.
Plus, they literally travel away from their home in the beginning
Yeah.
of the movie.
Yeah, they do.
And also, like at the end, when like Black Phillip is leading her away, could that just be another fugue state?
That's what that's how I would.
Now again, if Black Phillip though is the repackaging of Captain Black, it's a fugue state that's induced by a substance because that's what
Yeah.
Captain Black does. So we're always thinking that, right? Now, having said that, let's say that none of that exists. There is no evidence, hypothetically, that this is induced by a substance, and we think that there are clinically significant gaps in memory. Rule out dissociative amnesia. Or
Dissociative identity.
yeah, that's the other one, right? Dissociative identity. If an individual has two distinct personality states that take over the conscious awareness, even with that they're meeting the full definition of dissociative amnesia, the single best answer is still DID. Right? So you need that, and there's a hierarchy here. If they rule in for DID, it's DID. If they don't, but then still rule in for dissociative amnesia, it's DA. And if they don't, but they still rule in for depersonalization and or derealization, that is clinically significant, then it's depersonalization, derealization disorder. So you've got to work that hierarchy. And of course, it's none of the above if induced by a substance or an underlying medical condition. Right? So that's the way as a clinician I want you to think. That's the way as a student I want you to think through your clinical vignette on your shelf next week.
Maybe like her being a witch is her other identity.
Her being the witch.
Like like so at the end she's like
Mhm.
that's her,
Then we're going to have to get into why. Yeah. Right? That's where we begin to consider why was this family thrown out of that settlement in the first place?
Yeah, they never actually really say
They
why.
just said that they had like slightly different views, and so they got kicked out. Because the dad seems to have his own bizarre version of like puritanical religion. And I also think like potentially there might be something going on with it. There's definitely something going on with that dad. He's
Mm-hmm. Anybody want to go there?
yeah.
We'll pull back the reins on any discussion of the dad contributing to the potential etiology of Thomason's DID. Let's not go there. I think we all know what that might be. Anything beyond that we want to talk about dad?
I mean, one of his like sin, I guess, is pride. He mentioned how the reason why we're in the situation is because of my pride. I just like tempered him. He could have been in the settlement. He would have never had to deal with this. So that's one thing.
And also, we mentioned how the mother had like postpartum psychosis, which is like indication like about she might have had bipolar previously or later. And so I think it would be interesting if like the father also, because the things he say are like kind of manic at times, and he has like this very grandiose sense of self, and he does these like kind of impulsive actions, and he seems to be quite irritable as well. So potentially maybe like both of the parents have like an element of mania that kind of caused this very chaotic family sort of situation to really start, and might also be why they have so many kids because of like those like
Indiscretions?
Yeah.
If that is true, then we have to, I think, reshape what we think is going on with Thomason, because with two parents having bipolar, that changes the landscape for what ails Thomason.
Yeah.
By the way, bipolar disorder, if asked, the highest comorbidity rate with substance use disorder, right? 60%.
Yeah.
So if that is true, it doesn't take away anything we discussed pertaining to substances. Right? Matter of fact, it might even support it, right? All right. Closing comments, thoughts, anything else going on with any of these characters you want to further discuss?
Yeah, I was going along the lines of the 7 deadly sins, right? And I saw the
Yeah.
goat represents lust. It is interesting that the goat was the goat, and the goat killed the father. So potentially he could have been afflicted by, his sin could have been lust. We don't know too much. Maybe, that could have been his problem. And out of the twins, one of them could have been the sloth because one was lazier than the other. And if you start assigning them, I think you can kind of go back and forth with who is who. But more importantly, Thomason, I think she is afflicted by the sorrow, despair, sin at the end when she's left alone, right? And she's in this area of despair, just looking at the woods I'm all alone, I'm probably gonna die here, or could become a witch. I think that's maybe her. She finally falls, to the sin of, despair, and then that ends up killing her. I think all the different sins kill the family members potentially, and then she eventually falls to despair at the end. And that was kind of what I found online. I was trying to piece together. So possibly.
I just think that lust, it would be better if it was Caleb,
Yeah.
the brother, because
I
that was
agree.
the other thing I wanted to bring up too. I forgot about it, but he there are a lot of it's shown by the camera angles,
Mhm.
because when they're by the river, him and Thomason, and he looks over at her, the camera shot goes to her chest area, and it's very heavily implied that he has incestuous feelings for his sister, which is probably brought about by the whole by the fact that one, they're isolated, and two, they've been told that they're inherently evil their whole life, and so all the suppression of all those feelings probably leads.
And the witch that got him was the
Yeah.
most
Yeah.
Also, the mother references that, but blames Thomason for tempting Caleb.
Yeah, which is the whole. I mean, for hundreds of years, it was pretty much blamed on women too. The whole oh well, what were you doing? What how did you influence him? That kind of thing.
I also want to say for the bipolar tie-in, all of these things fit really well as well, just because those hypersexual behaviors are commonly seen in mania, and then at the end, Thomason kind of falling to despair fits the depression aspect of it, in bipolar, and then also the father having those I think we mentioned that, and the father I was gonna say something. Either way, I think those two things fit well into bipolar as well, and it kind of fits into why the entire family likely kind of from our theory also got into substance use disorder as well.
Yeah, again, very high comorbidity rate. Again, for quick review, and we'll close with this. For your shelf exam, bipolar 1 is going to be defined strictly through having had a manic episode at any point in one's life. So a clinical pearl is that if your patient is presenting and has no current or recent symptoms of dig fast, that means nothing. If they had an episode of mania at any point in their life, they are bipolar 1. The only exception to that rule is schizoaffective bipolar type, right? Otherwise, they have bipolar 1. If they have the same exact signs and symptoms, dig fast, but it did not reach a week and it was not clinically significant, that is called hypomania. Right? And if they have hypomania alternating with major depressive episodes, that's called bipolar 2. If they have hypomania alternating with episodes of depression that do not reach full criteria of a major depressive episode, that's called cyclothymia. Right? Treatments are pretty much the same. You take your FDA-approved medications for bipolar 1, and you can treat clinically significant bipolar 2 and or cyclothymia, although if you really want to remain strict to the DSM, they're not clinically significant. Right? Now, bipolar 2 can be because of the major depressive episodes. Right? What is rapid cycling?
It's having 4 or more episodes in 1 year.
And what's the treatment of choice?
Same 3. 2, sorry, 2.
Which ones?
Are guys on lithium?
Hmm? That's the one we have to avoid, right? Lithium can actually worsen,
So then valproic
Yeah.
acid
and carbamazepine.
and carbon.
Good. All right. Questions about bipolar?